Hello, my name is JOYCE Gonzalez Ingles and my topic is pneumothorax. Pneumothorax is defined as the presence of air gas in the pleural cavity, the potential space between the visceral and parietal pleura of the lung, which can impede oxygenation and/or ventilation.
During normal respiration, the lungs expand and contract within the chest cavity. The lungs are encased by two layers of tissue, similar to a fist that has been pushed into a balloon. The space between the layers, called the pleural cavity, is lubricated so that the lungs can slide comfortably across the chest wall. If air enters the space, it is referred to as a pneumothorax. One type of pneumothorax, called a traumatic pneumothorax, can be caused by an injury to the chest. A blunt or penetrating chest injury can cause a small tear on the surface of the lung, allowing air to enter the pleural cavity and to become trapped. The pocket of air produces excessive pressure on the lung, causing it to collapse. A spontaneous pneumothorax occurs without injury as a result of certain lung diseases, such as asthma, emphysema, or COPD. Small air-filled sacs called blebs can form on the lungs. If the blebs rupture, they can release air into the pleural cavity. Pressure from the trapped air causes the lung to collapse. However, a spontaneous pneumothorax can also develop in a person with no obvious risk factors or disease. This condition is more common in smokers and in men between the ages of 20 and 40. A tension pneumothorax is a serious complication that can develop with any pneumothorax. If the pocket of trapped air cannot escape and continues to grow, the increased pressure in the pleural cavity can push the heart and major blood vessels to the other side of the chest. When this shift takes place, it causes a significant drop in blood pressure. This is a life-threatening condition that requires immediate medical attention.
In applications in medicine, types of pneumothorax. Spontaneous pneumothorax, no clinical symptoms in primary spontaneous pneumothorax until a bell ruptures and causes pneumothorax. Iatrogenic pneumothorax, symptoms similar to those of spontaneous pneumothorax depending on patient's age, presence of underlying lung disease, and extent of pneumothorax. Intention pneumothorax, hypotension, chest pain, and catamenial pneumothorax, women aged 34 years with hands-on symptoms within 48 hours of intervention, right side pneumothorax and recurrence. Pneumomedicine patients may or may not have symptoms of chest pain, persistent cough, sore throat, dyspepsia, and shortness of breath, or nausea, vomiting.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 561. Pneumothorax. What are some physical examination findings observed with pneumothorax? In pneumothorax, you would see unilateral chest pain and dyspnea. There's also going to be unilateral chest expansion, along with decreased tactile fremitus. And as we mentioned earlier in the chapter, that fremitus is the palpable vibration with low-frequency vocalization. There would also be hyperresonance on percussion, which means that there is air-filled cavity underneath the area you're percussing, as well as diminished breath sounds. What is spontaneous pneumothorax? Spontaneous pneumothorax is when there is accumulation of air in the pleural space. What demographic does spontaneous pneumothorax commonly affect? Spontaneous pneumothorax commonly occurs in tall, thin young males because of rupture in the apical blebs. Describe the tracheal deviation that you see with spontaneous pneumothorax. In spontaneous pneumothorax, you will see the trachea deviating towards the affected lung. What is tension pneumothorax? Tension pneumothorax is a condition in which there is air that enters the pleural space, but it's not able to exit. This type of pneumothorax commonly occurs in the setting of trauma or after lung infection. Describe the tracheal deviation you would see with tension pneumothorax. In tension pneumothorax, you see the trachea deviating away from the affected lung. How do you treat tension pneumothorax? If you suspect tension pneumothorax, you have to right away do a needle decompression. You don't have to wait for a chest x-ray. Anytime you suspect tension pneumothorax, you have to do a needle decompression before even confirming the diagnosis with the chest x-ray.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us.
Initial outbreak. Treatment involves the lungs to expand and reunion the pleura. And if you suffer fits and it's not extensive, cell treatment is a rate of 5 days. If the pneumothorax is more extensive, needle aspiration is also evacuated.
In open pneumothorax, a wound creates an open passage between the external environment and the pleural cavity. Air can potentially pass in and out of the chest cavity through the hole in the chest. With the loss of negative pressure in the pleural space, which would normally hold the lung in an expanded state, the lung on the affected side will now collapse. With inspiration, the ribcage will expand and the diaphragm flattens, but the negative pressure may now pull air into the chest cavity through the hole in the chest wall. Depending on the size of the wound, the affected lung may partially expand or may remain completely collapsed. The effect of air being drawn in through the hole in the chest has led to the term sucking chest wound, though this movement of air may not always be obvious. Treatment of open pneumothorax involves applying a seal to the chest, which, by means of a valve, will allow blood and air to be expelled during exhalation, allowing a negative pressure to be created and the lung to re-inflate. The patented Russell chest seal represents a state-of-the-art dressing designed by leading trauma experts for this specific purpose. It has a valve designed to open with a small positive pressure gradient and with sufficient capacity to allow a high flow of air and fluid to pass through it. 4 apertures allow this to happen efficiently and with minimal risk of obstruction. On inhalation, even a small negative pressure will make the valve close, even in the presence of fluids such as blood.
In conclusion, it's the next.
Go through the audio-visual course objective to see what you will learn in the simulation. Go through a detailed patient's profile and observe the vital signs of the patient. Check all the signs and symptoms that you have observed in patient. Learn how to auscultate the patient to hear the breath sound during assessment and diagnosis. Learn how to auscultate the patient to hear the heart sound while performing assessment and diagnosis in virtual environment. Learn how to percuss the patient while performing physical assessment and diagnosis. Classify the sound that you heard during the percussion by taking small quiz. Go through the summary of the assessment and diagnosis. Learn through an easy animated instructions to locate anatomical landmarks such as second intercostal space. Learn how to locate the second intercostal space on obese patient in virtual environment. Learn how to sterilize the insertion site using betadine solution in simulation-based environment. Mark the insertion site in virtual environment. Interact and learn how to place the needle on insertion site. Perform the needle decompression in an interactive virtual environment. Interact with hemostat and clamp it around hub of the catheter. Secure the catheter and hemostat using tape. Go through a detailed conclusion to refresh what you learned in the simulation.